Tonight, more employees are coming forward, speaking out in the wake of our Contact 7 investigation that exposed serious shortfalls inside a facility meant to help Coloradans in need.
We're talking about Clearview Behavioral Health in Johnstown. They're accused of not discharging patients that are ready to leave, short staffing, private and Medicare insurance fraud, minimal or no care from doctors or therapists, and serious sanitation concerns. A week after our first report, state regulators showed up at Clearview for an unannounced inspection.
And it lasted 2 weeks, and tonight, a respected Colorado politician and mental health advocate is calling this a matter of life or death.
You work there as a nurse. What does that email say to you?
That they're not worried about their patients at all, that they're worried about their census and the money.
What did you see in those reports?
I was horrified.
He's Colorado's former Speaker of the House and the former CEO of Mental Health Colorado.
I thought to myself, if this happened to somebody in my family, I would want to rip someone from limb to limb.
Andrew Romanoff watched what Contact 7 uncovered earlier this month.
I could tell you that patient care was definitely not a #1 priority.
It's a scandal what they're doing.
You can't treat people the way that they treat people. People are not animals. People are not paychecks.
It shouldn't take an investigation from an enterprising reporter or a courageous staff member. There ought to be a mechanism in place to monitor safety conditions, because what we're talking about here is literally a matter of life and death.
Our investigation exposed state documents and included testimonials from now more than 3 dozen insiders, including both current and former employees, patients, and family members. Accusations of understaffing that places patient and staff safety at risk. Accusations of keeping patients longer than medically necessary. Accusations of prioritizing profit over patient care.
I'm not a prosecutor, but if these allegations are true, people ought to be going to jail.
They're not getting the real therapy that they need. They're being held there, that they shouldn't be staying there.
She's a licensed nurse. Like the other former employees and patients, she fears retaliation and requested we protect her identity. She quit working at Clearview after less than a month, disgusted with what she experienced. How do you think state and federal investigators will react to knowing what you just said?
I think that they should be disgusted and horrified that family members and patients that are mentally ill or just needing some assistance are being stuck in facilities, and taxpayers and insurance money is being used improperly.
What is your message to the senior management at Clearview right now? Randy Kirkendall is leading one of 4 ongoing state and federal investigations into the Johnstown mental health facility.
Our message to the senior management of Clearview is that there are problems. Those problems have been recognized. Those problems must, and I want to emphasize, those problems must be fixed.
Less than 2 weeks after our initial report, the state of Colorado downgraded Clearview's operating license.
I think it's important to note that we did experience an uptick in terms of information with regard to this particular investigation following your last broadcast.
And since that report, more insiders have also reached out to Contact 7 Investigates, all wanting accountability for the way Clearview has operated. You worked there for 2 years. Did you see questionable practices when it comes to insurance billing?
Yes, they need to be shut down. There is no reason why they should be allowed to care for people. It's not a chance in hell.
Is it a possibility that you could close Clearview?
It is absolutely a possibility. Under no circumstances will the department allow poor care, dangerous care to continue.
We again reached out to Clearview CEO Rick Harding, asking him to respond to the accusations raised by many. Our request again denied. A spokesperson telling us the facility stands by a statement it issued earlier this month, promising to follow all direction provided by state regulators. With Contact 7 Investigates, I'm Chief Investigative Reporter Tony Kowaleski.